If you're taking metformin and thinking about adding berberine, this combination needs more attention than most. Berberine is one of the few supplements with real human data behind it for blood sugar. And that is exactly what makes pairing it with metformin a conversation worth having before you start. As a pharmacist, the patients I worry about most aren't the ones who skip their medication. They're the ones who add berberine on their own because they read it works and never mention it to the doctor managing their diabetes. Here's why that matters. Most supplements that claim to lower blood sugar don't really do much. Berberine is different. There are actual randomized trials showing meaningful drops in fasting glucose and A1C. So when you stack it on top of metformin, you're not adding a placebo. You're adding a second compound that genuinely lowers blood sugar. Now, here's the part most people miss. Berberine and metformin don't just both lower blood sugar. They work through overlapping cellular machinery. Both activate an enzyme called AMPK, which tells your cells to use glucose more efficiently and tells your liver to make less of it. That's the same general territory metformin operates in. So this isn't two unrelated effects bumping into each other, it's two compounds pulling the same lever harder. The practical concern is additive hypoglycemia. Metformin on its own rarely causes blood sugar to drop too low. But add berberine at a full therapeutic dose, usually 1,000 to 1,500 milligrams a day, and the combined glucose-lowering load gets harder to predict. The people most at risk are those already on higher metformin doses, anyone with well-controlled A1C close to their target, and older adults, where low blood sugar can show up as confusion or a fall instead of the classic shakiness. There's also a smaller, more preliminary concern. Some early lab research suggests berberine might affect the kidney transporters that clear metformin from your body. That isn't confirmed in humans yet, but it's worth knowing about, especially if your kidney function is already reduced. So what should you actually do? First, don't start berberine without telling the doctor managing your diabetes. This is the single most important step. Second, if your provider gives you the green light, start low, 500 milligrams once daily, not the higher doses on the supplement label. Third, monitor your blood sugar more closely the first few weeks and watch for trends, not just emergencies. Readings running consistently lower than usual is information. Fourth, never adjust your metformin dose on your own based on what berberine seems to be doing. If you want the full breakdown, the specific risk groups, the monitoring approach, and how to have this conversation with your provider, I've got the complete pharmacist-reviewed guide on LiveHealthyRX.com. The link is right below this video. And if this kind of supplement-drug interaction breakdown is useful, consider subscribing. I cover one of these every week.